If you're a caregiver, you already know bath time can be a real source of stress for everyone. But what if the whole reason for that stress is actually a myth? Today, we're going to talk about a totally different way to think about senior bathing, one that's all about health, comfort, and most importantly, dignity.
This is the big question, isn't it? We've all been taught that a daily bath is just what you do for good hygiene. But it turns out, for older adults, that lifelong habit might actually be doing more harm than good.
And look, if this quote hits home for you, you are so not alone. The worry about hygiene is completely valid, but so is the sheer exhaustion from that daily battle. Just admitting that it's a struggle is the first step to finding a much, much better way.
So, okay, what does a new, healthier routine actually look like? Let's dive into what the experts say about a bathing schedule that truly respects an older person's needs and, frankly, eases the burden on you, the caregiver.
And here it is. This is probably the most important piece of advice, and for a lot of you, it's going to be a huge relief. For most older adults, a full bath or shower just once or twice a week is perfectly fine. That's really all it takes to prevent skin problems and infections. I want to be clear, this is not neglect. It's smart, adaptive care. And there's a really clear scientific reason for this. You see, as we get older, our skin just naturally gets thinner and drier. All that frequent washing, especially with hot water and harsh soaps, actually strips away the skin's natural protective oils. It leaves it dry, fragile, and just vulnerable. And this isn't some rare issue. In fact, the American Academy of Dermatology says that more than half of all seniors have skin that's dry enough to crack, itch, or get inflamed. It just goes to show how quickly overbathing can turn a little dryness into a major source of discomfort, or even an open door for infection. Okay, so if a full-on bath or shower is only happening a couple of times a week, what about the other days? Well, this is where some really practical alternatives come into play. These are great ways to stay clean without all the stress and physical work of a full shower.
The classic sponge bath is an amazing tool. Seriously, it's way less physically demanding, and you can do it in a nice, warm, comfortable room instead of a chilly, slippery bathroom. That makes it absolutely perfect for anyone who has limited mobility or maybe even a fear of the shower.
Now, giving a sponge bath is actually a pretty simple and dignified process when you follow a few key steps. First things first, get all your supplies ready and make sure the person is warm, maybe covered with a towel or a blanket. Then, you always want to start at the top, with the face and head, and just work your way down the body. The real key to comfort and dignity here is privacy. Uncover, wash, and dry just one small section at a time before covering it back up. It's also a good idea to use a fresh, clean washcloth for different parts of the body, to avoid spreading germs. And finally, you'll save the private perineal area for the very last step. And there are even more no-water options out there that can be total game changers. Things like no-rinse cleansers, those pre-moistened bathing wipes, and even shampoo in a cap form are incredibly effective for those in-between days, or for times when even a sponge bath just feels like too much. All right, now this is where we can make a real, meaningful difference. How do we take bath time from being this dreaded chore to something pleasant, or even calming? The secret really is to change the environment and the entire mindset around it.
These ideas might sound simple, but trust me, they can be transformative. A toasty, warm room? That's a must. Putting on some of their favorite soothing music can completely change the atmosphere. And think about the little details. Like, have you ever tried warming up the bathing wipes in the microwave for just a few seconds? That tiny act turns a cold, clinical wipe into a really comforting touch. Even just calling it spa time instead of bath time can help reframe the whole experience.
Now, while we're reducing how often we do a full bath, we absolutely need to increase our focus on targeted cleaning to prevent serious health issues. And this is especially true when it comes to preventing urinary tract infections or UTIs. When we're talking about preventing UTIs, especially for women, this is the single most critical habit to remember. Period. Always, always wipe from front to back. That simple motion is absolutely crucial for preventing bacteria from causing a really painful infection. And here are a few more really important prevention habits. Using moist wipes after using the toilet is just way more effective than dry paper. If you're caring for someone who uses incontinence briefs, checking them regularly, say every couple of hours, is so important. And a thorough, gentle cleaning at every single change is non-negotiable for skin health and preventing infection. This really sums it all up. Our job as caregivers isn't to enforce some rigid routine that's been followed for a lifetime. It's to adapt. It's to give care that's thoughtful, that's responsive, and that truly protects the physical and emotional well-being of the person we love.
So I'll just leave you with this thought. Letting go of that daily bath myth does so much more than just make your life a little easier. It lets us offer a kinder, more respectful, and truly dignified kind of care. So the real question is, how can you bring a little more of this compassionate thinking into your care routine starting today?